Good evening. Thank you so much for being here. As I said, my name is Sonja Brannon, and I'm here to share with you my experience of the summer of 2020 being someone who has an autoimmune disease. Actually, I have several, as you'll learn. So, it's March 2020. We all get flashbacks, right? We get that flashback of schools closing, businesses closing, the whole world just seems to shut down. And at that time, my husband was actually several states away, and he couldn't come home, not only because of the restrictions, but because they couldn't take a chance of him coming to me. So we hit June, and I'm ready for him to come home. My kids are ready for him to come home. He's ready to come home, and I call my immunologist, and I'm like, how can we get Rob home? And she gave us a plan of action. Now, again, I have an immunologist, and I have a rheumatologist, and several other goodies, because I have systemic lupus, I have Raynaud's syndrome, I have Still's disease, prednisone-induced diabetes, inactive Hashimoto's, and the real kicker, the common variable immunodeficiency. It's called CVID, and what it means is that an entire section of my immune system doesn't work right. It's either, it goes too low, it either doesn't make enough, or at times it doesn't make any at all. So I'm very susceptible to many things very easily. So, returning to June of 2020, we followed the plan of action that my immunologist gave us, and he comes home. Kind of a little bit of stress relief, and we think, okay, we're in for the long haul. It is what it is. At that time, we lived in a city, not here, we lived in a city where we had two other family members that were there. They were elderly, and they were also sick. They also had their own medical issues. So when they contacted us and said, hey, we really need some help, it never crossed my mind to say no. It never crossed my mind to even question that I would help them, because I've needed help all along in my life too. So we helped them, and on July 1st, 2020, our whole world changed. That day, one of the family members tested positive for COVID. And that person was immediately admitted into the hospital. I called my immunologist and I called my rheumatologist, and they kind of politely freaked, and they even tried to get me into the hospital. But at that point, it was to the point where if your oxygen levels were not below 90%, they couldn't admit you. There was no room. So I went home, and we just kind of waited. Now, I tested positive, my husband tested positive, and 2 of my children. So of the 8 people that were in our house, 5 contracted COVID. As I said, 1 was in the hospital. My husband, a very healthy 40-something, got so sick he couldn't get off the couch. My 2 children that did contract it, it was mild, a little off, but they were fine. And to everyone's utter disbelief, I was fine too. Little cough, not much else. And we fast forward to 2 weeks later, and I get a clean bill of health. The person that's in the hospital is getting better. And they come home actually at the end of the 2nd week. And my children are fine, my husband's getting better. He's still probably off, but he's getting there. And then we hit week 3. And I wake up with a headache. And I didn't really think much of it, to be quite frank, because I have lupus, and you can get lupus headaches. I have a history of migraines. I was just like, I'm gonna take my medicine, go to bed, we'll be good. So I took my first-line meds, and I went to bed, and I wasn't okay. I woke up, and it was worse. So I did my 2nd line of headache medicine, got some sleep, woke up, it was worse. So I finally called my doctor and said, hey, I'm getting a little concerned, what do you think? And they were like, well, have you tried this? And I was like, no, I haven't, that's a good idea. And they're like, okay, but if this doesn't work, you need to call us back. I said, okay. So I took it, got some sleep. It was so much worse. So my doctor told me, we need to get eyes on you, but you can't go to the ER because the ER is full of all kinds of stuff. Right? COVID, all kinds of stuff. So he was like, you need to go to an urgent care that you trust. I said, okay. So my husband drove me to the urgent care. I go in, and I'm going to tell you at this point, the story gets kind of splotchy because of what transpires. So I remember the doctor, and I remember he hooked me up to an IV and gave me some good stuff. Said I should feel better in about 15 to 20 minutes. And I remember I was sitting there in the dark, and I remember when the door opened, I could not believe that 15 or 20 minutes had passed because there was no break in pain. It was awful. He immediately started pulling out my IV, and he said, I'm calling an ambulance. And I said, no, my husband's, he's out in the parking lot, it's fine. He can take me. So he agreed, and they got me to the car, and as they're getting me to the car, the doctor tells my husband, this is the closest hospital. I want you to go straight there. He goes, and I'm calling ahead, and they're going to know that you're coming. And we were like, okay. And I can tell you, I don't remember anything about getting to the hospital. I couldn't tell you to this day what car we were in. I don't know. We get there, and I know that my husband said my name, and a wheelchair magically appeared. And I remember being pushed right around to the corner, passing a totally full ER. It was packed. There were people sitting on the floor because there weren't enough chairs. And I went straight into triage, and they put on the oximeter. They started the blood pressure cuff, and the nurse looked at me, and he said, does your wife's face usually look that way? And I look at my husband, and that dawn of understanding happened. I knew something bad was happening to me. And the last thing I remember during that period of time is what was said over the PA system. Stroke cart needed in the ER. Now, I know they did MRIs and CT scans and x-rays and blood work. I couldn't tell you what happened when. I finally got some medicine that did stop the pain, though, and I fell asleep. And I don't remember anything else until the gurney that I was in was moving, and it kind of jerked me awake. And I said, whoa, where are we going? And the nurse said, you're being admitted into the MICU. And I said, why? My headache's gone. And she patted me and kind of smiled and said, it's going to be okay. Go back to sleep. So I did. And I was in the hospital for 7 days. And it's all a blur. I know that I had a spinal tap, lots and lots of blood work. I know that I had more tests than I could ever fathom. Like, they tested, can she walk in a straight line? Can she walk up the stairs? Can she walk down the stairs? Can you put your tongue in certain positions to say certain sounds? Can you swallow water? Can you swallow soup? Can you swallow food? And at the end of it, I learned that I had had an ischemic stroke. What we didn't know was why, and what we didn't know was how much damage had been done. So when you have an ischemic stroke, the brain is a very interesting organ, and they tell you that they're going to keep doing MRIs of you, and they're going to keep checking what your brain looks like because they can actually take one further down the timeline, and they may see recovery. They could also see more damage. So they follow you. And then there was the interest of, why did this lady in her 40s have a stroke? Now, I had issues leading in. So there was concern that I had had what's called CNS lupus, or central nervous system-based lupus, or something else. Maybe I'd thrown a clot. But we didn't know. So all I knew when I went home is that I had had an ischemic stroke. That's it. And I went through 8 more months of MRIs, blood work, arterial scans, all kinds of things. And I was given medicines that have horrible side effects. If you know anyone that has autoimmune disease, the drug of choice is prednisone. It's a steroid, and it is great to get rid of inflammation. But with that comes a price. Steroids are caustic. They're not good for you. And I was on high-dose steroids. And during that time, that 8-month time, I gained 70 pounds. And I would look in that mirror, and I really didn't know who I was anymore. Finally, in April of 2021, I got the call from my neurologist. And he said, hey, I've looked at it, we've followed you, we've got this down. I want to talk to you about what happened and what this means. Okay, great. It's still quarantining, so this is a video chat. And he goes, Mrs. Brannon, you had a massive ischemic stroke. You are probably 3 to 5 seconds from death, and I can't tell you medically why you're here. And let me tell you, that's a gut punch, even all that time later. I had 4-year-old twins at the time, and all I could think is, they almost didn't have a mom. But then he said the thing that changed me for quite a while, because he said, we know why you had a stroke. You had post-COVID inflammation, and it caused a massive stroke. And I'm going to tell you that the person that brought COVID into my house is a family member, and they've known me for years, long, long time. They knew my history, and I got angry. This didn't have to happen. I was so angry for a long time. And we fast forward, and we hit the end of 2021, January 2022. I was tapering off the steroids. I was coming back into myself, but I was still angry. And I got to January of 22, and I just decided I had to do something. I had to find myself again. When I looked in that mirror, I wanted to see me. So I went to my husband and I said, hey, I'm going to lose weight. I'm coming off the steroids. We're going to do this. And he goes, yes, we are. And he joined me. And we started this journey, and we lost weight together. But it still wasn't okay. I was losing weight. Person in the mirror was looking a little more like me. But the anger was still there. So in the fall of 2022, I got the email, said, hey, do you have something you think you'd like to talk about? And I went to my husband, who's my biggest cheerleader, and he was like, yes, you need to do this. So I filled it out, and in November, I got an email back telling me that they would like to hear more of my story. And I was like, awesome. And so on December 16th, 2022, I came in and did a rough draft of my program. But it still wasn't me. I should tell you that I didn't really tell anybody what happened. My safe group knew, my mom, my dad, obviously my husband, and the people that were in my home. But that was about it. I didn't share on Facebook, I didn't share on Instagram, no one knew. So I'd never talked about it. So I went in, and I gave that rough draft presentation, and I went home, and I went upstairs. And I looked in that mirror, and I started sobbing. And I stopped, looked in the mirror again, and sobbed again. A couple of times later, I realized that person looking back at me was not only finally me, the anger was gone. It was cathartic. I had found peace and forgiveness by telling my story, and that's when I knew that I had to share this. Because the person looking back at me in that mirror, as Nietzsche said, out of life's school of war, what doesn't kill us makes us stronger. And that person looking back at me was so much stronger. I knew that I had to share my story. So that was me right in the middle of all my treatments. I gained 70 pounds. That's me a month ago. I've lost over 90 pounds. I'm off all blood pressure medicines, and I'm doing great. I want to tell you, and I want to bring home, that what happened to me didn't have to happen to me. And I want to tell you that the group of diseases that I have come under this umbrella that's lots of time referred to on social media as, but you don't look sick. And you're right. Especially now, I don't look sick. But it doesn't change the fact that I am, and that anything that's brought into my home can make me sick and can cause this kind of complication. So I knew that I needed to stand up here and tell you guys that this doesn't have to happen. There are people that you walk by in the grocery store, maybe even at work, might be even family members that you don't know that have compromised immune systems. And we have to worry all the time about what's being brought into our house and what does that mean. Because what's a cold to you, what may be a 5 to 7 day inconvenience of a flu, can cause exactly what happened to me from COVID. So let me be clear. This is not a COVID story. It's about COVID, but that's not my story, and it's not this story. Because it could be the flu, it could be pneumonia. Any of this could be catastrophic for people like me. So I want to bring home, especially as we come out of that COVID time frame, please continue to wash your hands. Please continue to use sanitizer. And if you're sick or someone in your home is sick, please stay home and let that illness stop in your house. Because there are people like me everywhere. And just one poor choice can be catastrophic. Thank you so much for your time.